Natalie Graham.
BBC CWR.
Now, trials of a new device designed to address threatened miscarriage are being carried out by a professor in Coventry. Designed to deliver vital doses of progesterone, the Callavid R device stands to help over 150,000 women each year in the UK. If approved, it would become the world's first drug device combination product to treat threatened miscarriage. And joining me now is Professor Siobhan Quenby MBE from University Hospitals Coventry and Warwickshire. And a very good morning to you, Siobhan. How are you?
Oh, fine. Good morning.
Thank you for getting yourself in as well, nice and early, so much appreciated. Firstly, can you tell us about the trials which have just received a large amount of funding?
So I'm really, really excited about this because we've done a lot of research in the past and we know that progesterone prevents miscarriage. But the problem is the current progesterone causes a lot of leakage. So the poor women who've suffered miscarriages in the past, we then give them a medication to stop them miscarrying, and the leakage causes enormous amount of anxiety and worry. And is the medication working? So I've worked with a company to make the first ever device to have leak-free progesterone. So we in Coventry are going to be the first place in the world that people are going to try this out. So the grant is to be the first it's called a first in human study. So the Coventry patients are going to be the first people to receive this. We're going to ask them lots of questions about what they think about it. I'm very confident it's going to make a major difference and help people all over the UK and also all over the world. So it's a real exciting first for Coventry, this.
And how is it different to what's currently being done?
So at the moment, there is a progesterone that you can get from the general practitioner or from the hospital, and you put it inside your vagina, but it leaks a lot. So you can imagine you have to put it in the morning and then you go to work. It's really... And you're worried all day at work, is it leaking? Am I miscarrying? Is the drug coming out? Is it not working? And you can imagine how difficult that is. And some women, find this such a worry that they actually get up an hour early in the morning to lie down so that it doesn't leak when they leave to work. Wow. So you can imagine you've got to get up, get your children to school, get the breakfast, get the family going. And first of all, you have to get up to put this medication, and it's really, really inconvenient for modern working women. So I've worked with this company and we've got a solution to the problem, and now we get the really exciting thing, which is to give it to the first woman, and that's what we're going to be doing later this year. So I'm terribly excited because I think this is going to help a simple problem, but it's going to help thousands of women whose lives are made very difficult by the current medication.
Now, I mean, my mum many years ago, I mean, I've got my brother now, bless him, but many years ago, my mum's suffered from a couple of miscarriages. Never would have known anything that you've just said here, even in terms of the progesterone or anything that can be a cause for this. So, and I do have other friends as well that have had sort of multiple miscarriages, and it's something that's almost a fear factor, especially for those who really are trying for a child. So I think that this is incredible. And there's also, is it right that there's different phases of the trials?
Yeah, that's right. So the next stage is the first time a human will get it, or be basically a woman from Coventry be the first person ever to get it. So that this is called a first in human trial, and then once we've done that and understood, we're also going to understand the feasibility of the trial, get lots of information, and then we will then have to do another trial to check dosing, and then when we've done all that, then it'll be able to go on the market and be widely available.
What is it that you hope to find out from this?
So first of all, that it works. So first of all, we've got to check that it doesn't leak, that it does deliver the progesterone, that there's plenty of progesterone that we can measure in people's blood, and that it's acceptable to patients. So because we've just this company I'm working with have just developed it, if there's anything that the patients don't like about it, we can make some changes in that. So this is real pioneering work. It's a Coventry first, so I'm excited.
And how long does this take to get from sort of coming up with something as I say an initial concept to actually getting it to the point that you've reached now?
Oh, we've spent years doing this, and so it's a lot of the delays have been getting funding.
Right.
So we're terribly grateful to the NHR, which is the research arm of the NHS, because they've given us funding to really get this off the ground. So that's the big excitement. As with everything else in life, you need money to get things off the ground, and that's what we've now got.
And as well as what's been established so far and sort of putting this now into practice, how many women could it actually affect?
So for the we give it for two reasons. One's for miscarriage and one's to prevent preterm labour. So for the miscarriage women, we think it's 150,000 in the year in the UK each year.
Oh, okay.
But it's hundreds and hundreds of thousands across the world, because it doesn't matter what country you're in, the leaking, it remains the problem. And this is the first in the world that will be leak-free, so it's really, really exciting.
And I mean, especially if the fact it's here in the heart of Coventry, that in itself is a huge deal, isn't it?
Yeah, so I'm really, really excited because that, Coventry's pioneering things, and I work at the UHCW, so UHCW is going to have a real first, and it's so exciting that we are able to do research that will change people's lives around the world. It's a really, really good thing for us, and most importantly, it's going to be really helpful to my patients who are actually incredibly inconvenienced by this leaking and causing incredible anxiety. And it's really difficult because I say to them every day, don't worry about the leaking, but it's no good saying don't worry, because it doesn't take away the worry. There's nothing I can do about it except to make this new device.
And surely as well, on an international level, when it comes to other sort of medical factors elsewhere, then all eyes are on you at the moment.
That's right, yeah. So there's a little bit
pressure.
Yeah, I am feeling. Yeah, you're actually right there. I'm feeling slightly pressured, but I've got a fantastic. There's a lot of work to do to set up a trial, but fortunately, there's a fantastic team at UHCW of research administrators and who can help me make sure I get all the paperwork right. I've got a fantastic team of research midwives who just work on miscarriage patients who'll help me. So thank goodness, although I'm feeling pressured, I have got a fantastic team who I can trust to help me with this project.
Well, again, I know that this is something that is genuinely going to change a lot of people's lives, and as I said, I've sort of touched upon this area and had people that have been affected by it. So it's huge in terms of sort of medical research and moving forward. So congratulations to getting to this point. And I'm hoping. In fact, how long will it take for the sort of trial period before you can take this to, let's say take it to market? I don't know if that's the right way to put it. Yeah,
so we're expecting to get to market within a few years, because we're expecting it to go very quickly now. So once we've done the first in human studies, we've also had interviews with the regulatory authorities to make sure everything we do is done the correct way, so that it will get regulatory authority approval. So we've got to do this one, then another study that will take a couple of years, and then to market. So I think we're really expecting things to accelerate now.
Well, Siobhan, I really appreciate you joining us this morning. So thank you very much. And like I said, all the best with the continued research as well. So you're going to be changing a lot of people's lives.
Oh, thank you very much.
No
Thank
problems.
you.
Thank you for joining me.